Then this is a picture showing, actually here the costophrenic angles are clear. But if you see this patient, here there is pleural effusion, but the difference here, actually what do you see, what are you seeing? You are seeing that one lung is whiter when compared to the other lung. Why is this so? This is because here the patient is in ICU and the X-ray is taken in supine position. In supine position, the pleural effusion, the patient is lying down, right, like this, and here the lungs will be present like this, right, and now the pleural effusion was behind the lungs like this. So as a result, because the pleural effusion, because it is a dependent area, the pleural fluid will get deposited all over the lungs, the on one side, whichever it is side it is positive, whichever side pleural effusion is present, on that side the lungs are layered clearly, or they are layered very well. So as a result, on supine position, in pleural effusion is actually layered out posteriorly, that is behind the lung. The pleural effusion is layered out. So as a result, the left hemithorax is more brighter than the right hemithorax. That means right lung is paler than left lung. So thus it is a pleural effusion. Then this is also a supine X-ray with right-sided effusion. This is also a supine X-ray with right-sided effusion. Always think that this is, whenever there is supine X-ray is done, and in the supine X-ray, if you are seeing this whitish colored or brightish colored only on one lung, whereas the other lung is clear, then always think of presence of some type of effusion. Even this is a supine X-ray where you can see this effusion is seen. See, this is some effusion which is seen in the patient. See, here you are seeing effusion mostly on the right side, but on the left side also there is some effusion. That is the reason when this fluid is drained, you can see the effusion on the left side clearly. See, this is the patient with large pleural effusion. If you see, this is large left-sided pleural effusion. Because of that, the trachea, see the shift of trachea like this, it is shifted. So because of that, the trachea is shifted to opposite side. Not only trachea but even the mediastinum, see the heart coming to this side, the right. So mediastinum is also shifted to right. So this means this is a case of passive pleural effusion on the left side. And then this right side, this is actually an encysted pleural effusion which is seen. Okay, now you can see this encysted pleural effusion which can be seen here. Now here, if you see here, you will see this laminar pleural effusion. Because see, it is not just blunting here, but even here also you can see this pleural effusion or thickening which is seen. This opacity which you can see here. So this is also a lamellar pleural effusion or laminar pleural effusion. It is very little on the left side. So this is the important features of the pleural effusion. In the next class, we will learn something else, but before that, we will see some important features of the supine chest X-ray also once more. Okay, what do you see on supine chest X-ray? Already, as I have said, whenever the patient is sleeping on supine position, this will be the lungs, something like this, and there will be pleural fluid like this. Now the pleural fluid is layered out posteriorly very well like this. Because of that, this side you will see that this is seen brighter or whiter when compared to the normal side. So this looks whiter more than the normal side. So that is what happens. Here, whenever the patient is sleeping, the pleural effusion or fluid is layered out posteriorly. So right lung, this right lung will look paler than the left lung. It looks brighter or paler than the left side. Similarly, if the patient is on intensive care therapy, in intensive care therapy also, the patient will be in supine position, number one, and sometimes that is one thing, and sometimes you can also see in these you can also see some effusion with consolidation also. That effusion and consolidation might sometimes be misdiagnosed. Then actually if you see this patient, this definitely there is large pleural effusion on the right side. That means here the volume of pleural effusion, here there will be at least 5 to 7 liters of pleural fluid will be present in this large pleural effusion. So this is actually called as white out lung. Okay, right. So this is about the pleural effusion. Thank you for watching.